How-to spine board. To assess a patient with possible spine injuries, manually stabilize his head and neck and assess his airways, breathing, and circulation. Be sure to use the jaw thrust maneuver to open and maintain the airway. Remember that a cervical spine injury can result in severe breathing problems, even respiratory arrest, so be sure to monitor the patient's airways and breathing continuously. To check the patient's circulation, check his radial pulse. If it is a child or an infant, check the brachial pulse. Signs of a spine injury include tenderness at the spinal column, pain with movement, numbness or tingling at the extremities, loss of sensation or movement, incontinence, priapism, and obvious deformity. After an initial assessment, a rigid cervical immobilization device or extrication collar should be applied to the patient. Never use soft collars in the field because they are nothing more than cotton-covered foam rings which do not prevent movement of the head and neck. Follow manufacturer's instructions for applying a collar. Though instructions will vary, all collars are supported at the same points: the maxilla or jaw, shoulders, and clavicles. Note that failure to fit a patient properly can aggravate the injury. When measuring size, measure from the mandibular angle to the clavicle. Use your fingers for measurement in comparison to the cervical collar. In general, to apply a rigid cervical collar to a supine patient, first slide the posterior portion of the collar in the gap under the patient's neck. Then, flip the anterior portion over the chin. Finally, secure the collar with the Velcro strap. Be careful not to pull too hard on one end. It can twist the patient's head. Whatever position your patient is in, you must maintain stabilization of the neck and head. Release it only when the patient is completely immobilized on a long backboard. Performing a log roll. To perform a log roll safely, you need at least 3 rescuers, preferably 4, who are trained in the procedure. One must stay at the head to maintain manual cervical stabilization and to coordinate the move. This responder will verbally control the maneuver. The other 2 should position themselves along one side of the patient's body. With that in mind, follow these steps. First, position the patient. Place his arms straight down by his sides if possible. 2. Get in position yourselves. At the signal of the rescuer at the head, the 2 at the side should reach to the far side of the patient. One rescuer should position his hands at the shoulder and the hip. The second rescuer should position his hands at the thigh and the lower leg. 3. On rescuer 1's command, simultaneously roll the patient onto his side. Be sure all 3 rescuers move the patient as a unit. Note that this is a good time to assess the patient's posterior if it has not been done already. 4. Position the backboard. A 4th person, another rescuer, a family member, or a bystander, should push the board under the patient. If no one else is available, one of the rescuers at the side may lean over the patient, grab the backboard, and pull it under the patient. 5. On rescuer 1's command, simultaneously roll the patient back down onto the board. If he is not in the middle of the board, gently pull him down and then up again until he is straight on the board. This is done at the shoulders and the hips by pulling in alignment with the long axis of the spine. Never push a patient over the middle of the board. 6. Reassess pulses, movements, and sensation in all 4 extremities. Report any change to the incoming EMTs. Once in place, pad the spaces between the patient and the board. For an adult, pad anywhere along the length of the body to maintain neutral alignment and provide comfort. For the infant and child, also pad under the shoulders. This is to keep the relatively large head from flexing forward. Take care to avoid extreme movement. Your next step is to secure the patient to the long backboard. Do this using tape. It should always be done in the following order. First, immobilize the head. Secure the head using tape. Make sure to fold over the tape where it will come in contact with the patient's skin. Once the head is secured with the tape, rescuer 1 can remove their hands from manually stabilizing the cervical spine. While securing the head, take a great deal of care not to lock the jaw in place. If the patient should have to vomit, he must be able to open his mouth. Next, immobilize the torso. Tape from the right shoulder to the left hip, then tape from the left shoulder to the right hip. Finally, immobilize the legs. Tape around the patient's hips, then the knees, and then the ankles. Reassess pulses, movement, and sensation. Report any change to incoming EMTs. Under command of rescuer 1, lift the patient smoothly and evenly. Still under control of rescuer 1, relocate the patient.